We know time seems to fly and the world just keeps moving, starts moving faster. But our hearts aren't supposed to speed up to keep up. A very fast heartbeat is a heavy-handed hint that your heart needs help. Dr. Mohammed Hajiri is here to define this disease. Dr. Hajiri is with the Heart and Vascular Center and is a cardiologist at MetroHealth.
Correct.
So welcome to the show again.
Thank you very much.
We're talking about atrial fibrillation.
Correct.
So can you tell me what is it that causes the heart to go so hyper?
So atrial fibrillation is an imbalance in the electricity of the heart where the heart becomes very fast. And this happens in one of the chambers of the heart. It's called the left atrium. And what happens is that this electrical imbalance that discharges very, very fast the patient starts feeling that their heart is palpitations. Sometimes this very fast heart rate can make patients can come in and out and then can make patients pass out. And it's very common in the elderly.
Okay, so if this is common in the elderly, how do we prevent it?
So the problem with atrial fibrillation is that apart from the symptoms that the patients start having, it can cause strokes. So when we manage atrial fibrillation, it's very important to prevent the strokes. In the left atrium that I mentioned, there's a small appendage. It's a little pouch that we call it the appendage. And this little pouch, what happens was that in the heart, when it goes so fast, instead of contracting like this, it's contracting like this. So the blood becomes static, it becomes slow in this pouch. And whenever the blood becomes slow, it tends to clot and form little tiny clots. Now this pouch can sometimes, this little clot, if it's formed here, can go through the blood and then go to the brain and cause a stroke. And can sometimes go to the rest of the body and cause other problems. So the main thing about preventing it's basically trying to prevent strokes is very, very important in atrial fibrillation. So
how do you do that? Blood thinners?
Correct. So one of the ways to prevent strokes is to start the patients on blood thinners. And the most common blood thinner that we have been using for many years is warfarin. And what warfarin really is actually rat poison that got modified, and we made it in doses that fits the humans. And it makes the blood thinner from its name, blood thinner. There are newer anticoagulants, like
so
warfarin.
There's other options.
There are other options. These include Xarelto, apixaban, and other of the newer medications that the patients can take, and can make their blood thin to try to prevent strokes.
Okay, what if the medication doesn't work?
So that's very important. The blood thinners, when let's say they don't work, especially in the case of warfarin, sometimes it is very difficult to give the patient the exact dose that works for their body. And we usually check that with something called INR. So if the INR, their level in the blood, if this is too high, it can give them bleeding. If it's too low, then that doesn't work. So sometimes we have to use other options that we have in order to prevent patients from getting clots in the appendage.
So one, I think you said, was the paddles, kind of shocking the heart back into.
So that is. So these are one of the treatment options we have, but this is for atrial fibrillation. When patients are feeling it, then we can shock them and put them into sinus. But this does not prevent strokes. This is not for the anticoagulation portion. This is to get the patients out of their bad rhythm, this atrial fibrillation, back into sinus. Now, I just want to stress that patients, when they do get shocked and back into sinus, that doesn't mean they can't take anticoagulations. They have to take anticoagulation. Anyway. And this is measured according to something called JADS-FASC. It's a score that we do, and it depends on how many risk factors the patients have. If they're diabetic, if they have heart failure, if they're female, if they're above 65 or 75, and or if they have peripheral vascular disease. All of these can add points, and if the patient has a high score, then they have to be on anticoagulation forever.
So it's really a complicated process.
It's a very complicated process.
And the bad news is, as we age, the possibility of developing atrial fibrillation increases. The good news is that there are many medications and procedures to manage it. My thanks to Dr. Hajiri for sharing some of the options with us today.
Right. So now,
to learn more, call MetroHealth at 216-778-7800 or visit their website, www.metrohealth.org.